When someone with mental illness does get arrested, a Bexar County program diverts them into a separate court system to better address their issues.
Last year in 2015, we had about 62,000 bookings. Only 31,000 of them went to the jail. So about 50% get released from the facility and not have to go to an actual jail facility. The uniqueness for Bexar County is that it's happening at the pretrial end. You're doing it all up front, and you're helping to take care of the issue up front and, hopefully divert them from the system for good. We're seeing phenomenal success with these cases that we've placed in there.
As far as identifying if someone has a mental illness, we have the law enforcement questionnaire. And there's also a screening that a clinician can do. Any of those could trigger someone having an indication of a mental illness, and that's when our office would become involved. The most important thing we do at Central Magistration is connect that person with a clinician, a mental health professional who can do an evaluation and a diagnosis. We use all that when we go before the judge to make the case that this person should be released to some form of treatment instead of sent to the jail.
I was very lucky that this program has been designed to help people like me that have trouble coping with their life.
Studies and evidence-based programs have shown treatment works, supervision works. So when you put those things together and you have the right services to connect them to, then your outcomes are better. These investments I think the county is making, I think they're cutting edge.
One of the greatest misconceptions of the public is that these are innately dangerous people, that because they have this medical condition, and it is a medical condition, that they're somehow more dangerous than someone else. And that's just not true. So a lot of what we're trying to do is public education, so we can educate not just the general public, but judges and prosecutors that the people we're helping are just people.